33.3, the respiratory system, the last section of the year. Respiration is the process of gas exchange between a body and the environment. We pick up oxygen and release carbon dioxide. The circulatory system is linked with the respiratory system at the lungs. We're going to go through each part of the respiratory system. In the nose, air is filtered, moistened, and warmed to help keep lung tissue healthy. Hairs do the filtering. The intranasal cavity and sinuses warm and moisten the air. The pharynx is next, where the air passes through the throat. This is a passageway for both air and food. Air then moves into the trachea or windpipe. There's a flap of tissue called the epiglottis that covers the trachea when you swallow food and liquid, making sure that the food or liquid goes into the esophagus and not into the trachea. If you eat too quickly, the epiglottis can't close properly and you can choke. Between the pharynx and the trachea is the larynx, voice box, which contains vocal cords. There's mucus in the trachea that traps inhaled particles. Cilia sweep both the mucus and trapped particles away from the lungs towards the pharynx, where the cough reflex is engaged. They can be swallowed or spit out. People with cystic fibrosis, if you remember, have very thick mucus, and the cilia can't move it up, sweep it up to the throat where it could be swallowed or spit out, and that leads to infection. The bronchi are the two main tubes in the lungs. There's one bronchus per lung. These guys branch off, get smaller and smaller and smaller until they're called bronchioles. They're surrounded by smooth muscles that regulate the size of the air passageways. The dead ends of the bronchioles are called alveoli. They look like clusters of grapes, and these are surrounded by capillaries. When air enters the alveoli, oxygen diffuses into the blood. Because oxygen concentration is greater in the alveoli than it is to the blood. So we go from higher to lower concentration. Carbon dioxide goes the opposite direction because its concentration is greater in the blood than it is in the alveoli. You can see that happening right there. The air you inhale contains 21% oxygen and 0.4% carbon dioxide. Exhaled air contains less than 15% oxygen and 4% carbon dioxide. Your lungs remove about a fourth of the oxygen in the air you inhale and increase the carbon dioxide content by a factor of 100. Diffusion of oxygen from alveoli into capillaries is passive, and it stops when the oxygen concentration in the blood and the alveoli is the same. Hemoglobin picks up that oxygen and enables diffusion to continue. Hemoglobin binds with so much oxygen that it increases the blood oxygen carrying capacity by 60 times. When carbon dioxide diffuses from body tissues to capillaries, it enters red blood cells and combines with water, forming carbonic acid. The rest of it is in the plasma, or it binds to hemoglobin and proteins in the plasma. The processes are reversed in the lungs, where carbon dioxide is released into the alveoli and exhaled. So how does inhaling and exhaling work? The lungs are in two sacs called the pleural membranes inside the chest, and at the bottom there's a dome-shaped muscle called the diaphragm. On an inhale, the diaphragm contracts and flattens, and muscles contract between the ribs, the interstitial muscles, raising the rib cage. These increase the volume of a chest cavity and lowers the pressure inside the cavity, creates a partial vacuum. Air rushes in due to that difference in pressure. Atmospheric pressure fills the lungs and air rushes in. On an exhale, the rib cage and the diaphragm relax. This decreases the volume of the chest cavity and forces air out of the lungs. Exhaling is usually passive, but to blow out a candle, speak, sing, or yell, you need more force than passive exhalation provides. That extra force is from muscles between the ribs and the abdominal muscles, which contract as the diaphragm relaxes. The only reason that breathing works is because the chest cavity is sealed. If a wound punctures the chest, even if it doesn't affect the lungs directly, air can leak in and make breathing impossible. This is why chest wounds can be so serious. You have some conscious control over your breathing, but it's not purely voluntary. Your nervous system has final control of your breathing muscles, whether you know it or not. Breathing is initiated by the medulla oblongata in the brainstem. Sensory neurons that are located there and in blood vessels gather information about carbon dioxide levels in the body and send that to the breathing center. When stimulated, the breathing center sends nerve impulses that cause the diaphragm and chest muscles to contract, and that brings air into the lungs. 3 of the most dangerous substances in tobacco smoke, so problems with the respiratory system is what we're going into now, are nicotine, carbon monoxide, and tar. Nicotine is addictive. It increases heart rate and blood pressure. Carbon monoxide is poisonous gas that blocks hemoglobin from binding with oxygen, so that decreases oxygen transport. And then tar contains 60 carcinogens. Tobacco smoke paralyzes cilia in the trachea, so inhaled particles will stick to the walls of the respiratory tract or enter the lungs, and that mucus becomes trapped along the airways. Irritation from accumulated particles and mucus triggers a cough. Smoking causes the lining of respiratory tract to swell and reduces airflow to the alveoli. Damage to the respiratory system can lead to diseases such as bronchitis, emphysema, and lung cancer. Smoking reduces life expectancy. Only 30% of male smokers live to age 80, but 55% of male non-smokers live to that age. In chronic bronchitis, the bronchi become inflamed and clogged with mucus. Smoking even a moderate number of cigarettes can produce this. People who are affected can even find climbing stairs difficult. Treatments can control the symptoms, but there's not any cure. Long-term smoking can lead to emphysema, the loss of elasticity and breakdown of lung tissue. People can't get enough oxygen to the body tissues or get rid of extra carbon dioxide. Medication can treat emphysema, but there is no cure. And finally, lung cancer. Because lung cancer is from an internal organ, by the time it's detected, it usually has spread. Very few people live more than 5 years who have lung cancer. And about 87% of lung cancer deaths are due to smoking. Smoking also affects the circulatory system. It constricts blood vessels, so it raises blood pressure, forces the heart to work harder to deliver enough oxygen. Non-smokers that are exposed to secondhand smoke are at greater risk for respiratory and circulatory system disease. Children of smokers are twice as likely to develop asthma or other respiratory problems. Pregnant women who smoke can harm their babies. You can see what secondhand smoke can do here. Unfiltered exposure to cancer-causing chemicals messes with asthma, increases ear infections, causes sticky platelets and damaged blood vessels. 70,000 deaths a year from heart disease. Whatever the age of a smoker, health can be improved by quitting. Nicotine is addictive, and it makes it difficult to quit smoking. So the best solution is not to even start.